Good morning and welcome to another episode of Deep Driving. I'm actually trying something out with some lighting here to get a full effect, so hopefully it helps. I went to a networking meeting this morning and I was listening to a chiropractor and an orthopedic surgeon talking about people that come in and they have back pain. And it was interesting because nowhere in the conversation that they were talking to the other members of this networking group did they talk about exercises for stretching. Nowhere in this conversation did they talk about exercises for strengthening the back or strengthening the neck. And I remember about 15-20 years ago when I used to do personal training, my job was to focus on the problems and not the symptoms. I found, and this is my opinion, that American society focuses too much on covering up the symptoms. If you have back pain, then obviously you need anti-inflammatory medication, you need muscle relaxers, and then you also need exploratory surgery. What's that? Well, we knock you out, we cut you open, and we try to figure out what's going on. And most of the time, what I found when I used to work with people and my focus and my commitment was to helping them get rid of their back pain was that their hamstrings were way too tight, or their gluteus maximus cardassianus, that's a technical term, I looked it up, their butt cheeks were too tight. Not many people stretch. We sit all day. We don't realize the impact that our tightness of our hamstrings and our glutes and our piriformis and even the side muscles that go up and down the leg, how much of an impact that has. So my thought today is to you, anybody that has any lower back pain, how often do you stretch your hamstrings out? If you're laughing because you don't even know what a hamstring stretch is, that's totally fine. How often do you go to a chiropractor or to physical therapy and they give you exercises and stretches to do at home? If you go to a chiropractor, you go to a physical therapist and they're not giving you exercises to do at home, consider they don't want you to get better. Consider that anybody that doesn't give you exercises to strengthen your neck and your lower back and stretches to do that just wants you to come back into their office over and over and over to continue giving them money, because that's my perspective on people that are focused on covering up the symptoms. Oh, and then the orthopedic surgeon started talking about how his father, who lives in another country, once a year comes and visits and he gives him his cortisone shot for relief. Another way that we as humans cover up our symptoms and don't want to deal with our problems. So my challenge to you is that if you have lower back pain, if you have any sort of pain that bothers, instead of covering it up so that you can be a little more comfortable, consider maybe stretching, consider maybe doing a plank exercise. If you don't know any stretches that you can do to help your back get stronger and become more flexible, then just message me or text me. Some people have this phone that they still use. Reach out to me at any of my contact information, and I will gladly email you over pictures and little write-ups about hamstring stretches and other things that I've done in the past that have people alleviate their back pain and not have to go into surgery. And if you're a doctor or a chiropractor or an orthopedic surgeon that's mad because I may have cost you some of your people, well, I hope you have a wonderful rest of your day, and thank you for watching. Please follow me on YouTube or Instagram or any of these other links that are on my social media, and share this with many people as possible. I appreciate you, and I hope you have a wonderful and pain-free day. Have a great one.